Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. Uh, Today, we're going to be talking about urinary tract infections, UTIs. Um, a pretty serious problem. Um, Literally, millions and millions of people get urinary tract infections, both men and women, though it is more common in women to men. Um, It's a very common infection that happens when bacteria enter your urinary tract and causes inflammation and often pain, burning when you urinate. Um, the infection can be in the bladder or in the tubing takes the um, that takes the urine out of your bladder and helps you exit. um, or in the tubing that goes up to your kidney, or even in your kidney. So it's the entire urinary tract that can be inflamed. Very often it is just the bladder, but it can be in any of those areas. And it's frequently caused by a particular bacteria like E. coli, though resistant infections can happen. Um, And that's one of the problems, and that's what we're going to be talking about today. So, if you get pain, if you happen to have pain or a burning sensation during urination, dysuria, if you have frequent or an urgent need to urinate, and even after you go, you feel like you have to go again and again and again. Um, if your urine along with these symptoms is cloudy, or if it's bloody or foul smelling. Okay, normally urine is sterile, actually. Urine therapy was used as far back as the 1980s that I know of, probably even before that. And that's where people would actually drink their urine. Yeah, I know it sounds gross, but urine therapy can be very healthy and beneficial, particularly because you're going to urinate vitamins and minerals that you don't need, that you don't utilize, and now you can re-ingest it. It's not an unusual thing. Even in survival training, they teach you that you can drink your urine up to 3 times before it becomes toxic. And this may save your life if you're caught in a desert or something like that. Now, along with the bloody, cloudy urine, the frequent urination, the pain or burning on urine when you do urinate, you can have lower abdominal pain or pressure in that area. And when it gets really bad, particularly if the kidneys are involved, you might get fever, chills, and even back pain. So, very common infection. Women are more prone to UTIs than men because they have a much shorter urethra. So when they're wiping themselves after they urinate, if their hands are dirty or if they're touching something that isn't perfectly clean, bacteria can get in and mosey its way on up through the urethra into the bladder. And keep in mind that it's very close to the anus. So, based on what they might touch when they're wiping themselves, if they're sitting on the pot, it just makes it easier for them to get the infection. Um, but there's other factors that are involved in it. Sexual activity can cause inflammation and irritate that, particularly for a man. Certain birth control methods, like using a diaphragm. Diabetes leads to, a weakened immune system, and often diabetics get UTIs. Um, if you happen to be catheterized after a surgery, it certainly leads to these infections. Um, when you get the bladder infection, it's called cystitis. When you get the urethral infection, it's called urethritis. And pyelonephritis is when it gets into your kidneys. Now you're getting into life-threatening situations. Now, the way it's diagnosed, and whether you need to diagnose it or not, just from the symptoms alone, trust that you have a urinary tract infection. A urine sample is often taken, and they're looking for white blood cells, which you should not have in your urine, along with red blood cells, etc. So urine cultures are basically used to help in the diagnosis of all this. And if you go to an urgent care center or an ER, if you don't have urgent care centers near you, they're likely just going to prescribe antibiotics. That is the primary treatment for it. What initiated me doing a show on this is because we see it frequently, way too frequently, is that people have become resistant to antibiotics. And then you can develop different types of infections like Klebsiella and whatnot. And traditional antibiotics don't always work on these recurrent infections. And recurrent infections are extremely common with UTIs. Though women are 50 times more commonly getting it than a man, trust me, men get it as well. And children get it at the same time. Though it's less common in children, don't know why, but children seem to get it, and girls 3 times more often than boys. Now, how can you prevent it? Stay well hydrated. The average adult needs to drink 3 or 4 liters of healthy liquid healthy water a day. Unfortunately, people drink unhealthy water, okay? Particularly water that may be too acidic. So having a more alkaline water to drink might be beneficial for a lot of people. Emptying your bladder regularly, holding it in, because you don't want to run to the toilet is a mistake. That can help. Bacteria to proliferate in your bladder. So and of course come up your urethra, whether it be in a man or a woman. So if you're going to touch yourself, please wash your hands. Okay, women, wash your hands before you go to sit down. Yeah, I know you think to do it afterwards, but now you're going to start to think to do it before you sit down, before you urinate. Always wipe women from front to back, never from back to front. Always wipe towards the anus, not from the anus forward, because now you're taking bacteria that may be there and transmitting it into you. Men don't have that as an issue. They basically just shake. Okay. If you have sexual activity, very important thing people don't talk about is go to the toilet as soon as you can and urinate. This will help clean out the penis and certainly wash out vaginally so that you hopefully won't get one from that. Now, cranberry has been used to help in the treatment of urinary tract infections, and there's enough studies that have shown its beneficial effects to the point where our FDA, I know you're going to be shocked, allows you to say that you can help in the treatment and in the prevention of urinary tract infections through the use of cranberry and cranberry products. I believe that cranberry contains, well, we know it contains proanthocyanidins, but I believe it also can contain other chemicals like mandelamine, methenamine, but also it contains D-ribose, which can help make the bladder and the urethra slippery so infections, bacteria cannot stick to the wall. D-mannose helps the bacteria slip off. And by slipping off, it can't get onto the wall and of the bladder and the urethra and cause infection. Now you can buy D-mannose also if you're prone to these infections, and you could be taking D-mannose and cranberry supplements as well. You know, flushing, taking cranberry supplements on a regular basis, particularly if you have recurrent infections, have all been shown to be beneficial in the prevention and treatment of it. And now the biggie. So I got published along with Dr. Reza Kamari and Eric Finkelstein Dr. Kamari and I, we did work, along with Eric's help, on the inhibition of E. coli and C. albicans with a dietary women's health formulation. And I'm published in the Journal of Food Science and Nutritional Research. And let's see, we were published, not that long ago, actually, just in February of last year. So we are now published showing that Doctor's Biome, Woman's Health, which now contains cranberry, organic cranberry. Now remember, Doctor's Biome is a very special probiotic beverage. It has 15 patented strains of bacteria, of next generation bacteria. That means they're created to survive the stomach over 90%, where capsule powders and tablets are destroyed over 90%. And then they're called smart probiotics, not because they went to Harvard, but because they were created to stick to the wall of your colon, the wall of your gut. So now that helps get yeast in balance again, kills bad bacteria, and replenishes the colon wall with healthy bacteria so you can absorb all these nutrients, if they're absorbable, into your blood. And that's why they took these 15 patented strains of next generation smart probiotics, and they had to give it a environment to grow and be healthy living in. Now that's the key word, living. They are living bacteria. Capsule powders and tablet probiotics are in suspended animation. They've been put to sleep with a freeze-drying process, hoping to come back to life. So if they do, up to 90% or more are destroyed in the stomach, and many of them don't come back to life. That's according to a study done by Segal and Eliav and Segal, Professors Eliav and Segal from the Weizmann Institute. You can read all about that and learn all about that on 60 Minutes. That show, which I'm not a particular fan of, but it's on CBS. And you can get a hold of it. It was public. They put it up. It's a 20-minute segment on probiotics back in June of 2020, I believe it was. June of 2020. So look up 60 Minutes Probiotics, June of 2020, during the pandemic, and listen to that show, and you'll understand why they were down on probiotics. Well, Doctor's Biome, Women's Health, answers all those complaints and concerns. It actually survives the stomach because it's not in a capsule that doesn't open up. It's in a beautiful, delicious, 100% organic watermelon, apple, pomegranate, beet, strawberry juice with the added organic cranberry. So this was then tested. Now remember, it's living in this, so all the prebiotics are in the juice. That's the food that the probiotics are eating. They're all alive, growing in number every day. So they start with huge number of billion colony-forming units, CFUs, and it increases every day. So from the date on the bottle, that's the date of manufacture, it's not an expiration date. From the date on the bottle, by the time you're getting it gets released after safety testing, it's in the 50, 60 billion, moseying on its way up at the end of the first month to 100 billion plus bacteria, CFUs, probiotics, and then more over its life before it starts coming down in number. So by the time that sells out, I mean, it just sells out so fast, you're probably getting 100 billion, give or take, in my opinion, give or take, colony-forming units, probiotics in 1 2-ounce delicious shot. And if you're going to have to give it to a kid, depending on their age, you can call my office up for UTIs if you happen to have a kid that's getting it. You'll call my office up at 212-581-0101. I'll give you that number again in a couple of minutes. But if you look at our paper, inhibition of E. coli and C. albicans, that's yeast, with a dietary woman's health formulation, and men can take it. They called it Doctor's Biome Women's Health, but it's for men too. It's not a woman's product only, though women more so will be using it. And complete suppression of E. coli in vitro. That means in a test tube. Well, patients have been using it all over the country, literally actually all over the world, and have been getting nothing but astounding results. In addition, some of them may have to take antibiotics, but you can take antibiotics with it. Remember, antibiotics are going to kill all the good boys off in your gut. You have to put the good boys back in. And you need to use it every day because we're always eating food and drinking liquids that are, whether you like it or not, are not sterile. And bad bacteria can survive the saliva in your mouth, the stomach acids, and get into your gut. So Doctors Biome Women's Health is fighting all that, helping with all that, and can make a major difference not only in the prevention of UTIs, but the treatment of UTIs. So you can get hold of our paper. Remember, it's published in Fortune Journals, the Journal of Food Science and Nutrition Research, the Journal of Food Science and Nutritional Research. Inhibition of E. coli and C. albicans with a dietary women's health formulation. And look my name up, Dr. Howard Robbins, and you should get it. Okay? You should buy the product. You can go to doctorsbiome.com, doctorsbiome.com, doctorsbiome.com. Biome, but it sounds like, but it's Biome. And when you go to check out, use my patient coupon code Howard35, okay? And you get 10% off the retail price. If you go on auto ship, you can get another 10% off. That's 20% off. Cancel anytime. Comes with 100% money back guarantee. I promise you have nothing to lose and everything to gain, okay? Intravenous ozone therapy has been used to treat this as well. Rectal insufflation, ozone, has been used to treat it as well. You can go to promolife.com and get set up for home care. Tell them you heard about it here on my show, and they'll help you get set up for home care ozone therapy. And this is another way, by putting some ozone in rectally. It's like an ozone enema. You can help treat it. Vaginally, you can do it. Women can do vaginal insufflation and help in the treatment of it. I don't think you're going to self-catheterize yourself and do that safely. So I'm not recommending women do that on their own. But you can set up for home care ozone therapy and do these things. And of course, in the very resistant and hard to treat recurrent infections, that's where intravenous ozone therapy comes in. And we use the direct IV method, the simplest method. Listen to my show called Intravenous Ozone Therapy, everything you need to know. We go over all the different methods and why we use the ones that we use. So in any case, you can call my office in Manhattan. Remember, doctorsbiome.com, doctorsbiome.com. Promolife, promolife.com, to get set up for home care ozone. So you may not live where you can get IV ozone therapy of any kind. So there you can start doing something to help yourself. Tell them you heard about it here. They'll do something special for you. And then you can call my office in Manhattan at 212-581-0101. That's 212-581-0101. And tell them you want to speak with Dr. Robbins, and they'll put you through. You'll be able to talk with me, and we can talk about how we can help you with these more resistant and frequent UTIs if you're constantly getting them. Everybody, thank you so much for listening. Please tell all your friends about the show. Listen to some other podcasts. Make sure you know all the different ones we've done, because then if you get something, you know to turn back to us to get some answers for it. And we'll be back again soon with another episode of Functional Medicine with me, Dr. Robbins. Bye now.